come through. Okay. Welcome to investigation room. This is an endothelial cell counter. We use it quite a lot for corneal work. And this is an autorefractor. The important thing with this autorefractor is that it uses Raytracing technology, so it's quite accurate. Okay, and then this is the endothelial cell counter. What it does is it counts the number of endothelial cells on the back surface of the cornea, which are quite important. It takes a photograph of that and it gives you a count, and it also looks at the shape of endothelial cells to see how much they differ from the normal endothelial cells. And we also privileged to have a Pentachem AXL, which is the latest model in our Pentachem Topography measurements. We also have an eye trace, which is one of the most technologically advanced pieces of equipment in the practice. It's a Wavefront analyzer. It's only found in a few practices. And come through, let me show you some of the examples. It's a patient that has gone toric lens surgery and couldn't see well following the toric lenses. And this Wavefront analyzer has a toric check module where we can look and see if the toric lens is sitting at the right axis. This is the internal wavefront. You can see this is the wavefront of the lens. The lens is sitting at 110-degree axis. And if you look at the corneal, the axis of astigmatism on the cornea, it's sitting at 85. So you have a 25-degree difference, a 25-degree difference between where the lens is sitting and where it's supposed to sit. And what's nice with this piece of equipment is that it gives you the refraction of the patient as is now. So this patient has a astigmatism, residual astigmatism of 3.87 diopters. And if we had to rotate the lens 25 degrees, we would get a 3.72 change in the cylinder power, and the patient will be left post-op with this little bit of astigmatism, 0.1 diopters of astigmatism. So you have a patient like this, you'll be able to take the patient back to theater, turn the lens to the right axis. This is another example of what this piece of equipment can do. There's a module called the dysfunctional lens index. So with the wavefront, we can look at the wavefront of the cornea. The patient, the E on the cornea, the wavefront of the cornea is pretty good. This is the right eye of the patient. And the internal wavefront, which is of the lens, is also good. And when you have early cataracts in patients, you tend not to know when to operate on this patient. With the DLI function, what I've showed you in the right eye is a normal DLI, and this is the left eye of a patient that shows a reduced DLI. Unlike in the other patient where the DLI was quite high and it was 10, in this patient it's 2.36, and you know to operate on a cataract like that. Sometimes we see this phenomenon with clear lenses where the DLI index has come down, but the lens is clear, and on a slit lamp you can't see a cataract. And the Heidelberg OCT, Ocular Coherence Tomography. The OCT is normally used to look at the macula. We take a line scan through the macula, which is the most important part of the eye, to see, and we can see the macula in the foveal area in more detail. You can actually see all the layers of the retina and see where there's any pathology. With the OCT, you can also take scans through the optic nerve and analyze whether it's healthy. We can also do a ganglion cell analysis on patients, and this is actually a normal ganglion cell. You can also analyze the ganglion cells of a patient, which are the innermost layer of the cells that you find on the retina, and they're quite important. And in a normal scan, you get a complete red donut of these cells, and this represents a normal scan. In this patient, however, you can see that the donut is not complete, representing an abnormal ganglion cell population. And if you can just look at this, the loss of ganglion cells respect the vertical meridian, and this is quite abnormal, and this patient actually would be suspected of having a pituitary tumor that presses on the optic nerve, and you can actually send this patient for CT scan analysis to see if they have a pituitary tumor or not. This particular patient has a macular hole, and it's well represented on an OCT. This young patient presented with a central serous retinopathy, just a detachment in the macular area, and we found him to have an optic nerve pit that caused the pathology. This patient came in for scleral lens fitting, which we can also do with OCT assistance, and this actually represents the scleral lens. This is the tear layer between the lens and the cornea. It's a keratoconic patient, and you can actually do direct measurements on the machine itself to exactly measure the tear layer thickness. With the OCT, you can look at the landing zone of the scleral lenses and make sure that they fit nicely on the patient's sclera, so that the lenses can be as comfortable as they can be, and you can actually do measurements on the OCT itself. You all know a Pentachem and its capabilities. It's used mainly for corneal work, especially keratoconus, to diagnose and follow keratoconus patients. Okay, this is the consulting room. Welcome. Let's have a chat. One of the biggest technological advances is in cataract surgery. The intraocular lenses that we use in cataract surgery have evolved, but now recently we've been using standard monofocal lenses that give you good distance at good vision at distance, but patients until now recently had to wear reading glasses for near vision. Recently, multifocal lenses have been introduced. This one in particular has a sinusoidal pattern that allows the best light transmissibility, and that allows the patient to see very well for distance as well as for near. All right, welcome to my laser room. Alright, this is where we do all the laser procedures, LASIK PRK procedures. With this particular machine, it uses cold laser, it uses YAG laser, and patients do not experience as much pain with PRK as they use with the old Excimer technology. And what's exciting about LASIK is we can treat astigmatism of up to 5 diopters, hyperopia of up to about 5 diopters, myopia of up to -10. And what's nice about the programs that we have on this machine is that now we can treat presbyopia, which is the aging eye. Patients that could not read and needed reading glasses can now be treated for them to be able to read when they have presbyopia without glasses anymore. This is a Zeiss series photo that we use for angiography to look mainly at diabetic retinal disease. And yeah, we do angiography on these patients and other retinal conditions. We also have an IOL master which is a machine that we use for biometry to calculate lenses for cataract surgery. Okay, this is a YEG laser that we use following cataract surgery to polish up intraocular laser lenses should they get a little bit of fibrosis. It also has an SLT module that we use to treat glaucoma to reduce pressure. We treated the trabecular meshwork with SLT. We have a pattern scan laser, which is an argon laser that we use mainly for diabetics to treat the retina, and it burns 24 burns per shot. And as a result, when argon laser treatments on diabetics used to take us about 30 minutes to complete, now you can do it under five minutes. Thank you guys for coming, joining me on a tour of my state-of-the-art practice. Hope to see you soon.